Bismillahirrahmanirrahim, everyone. Assalamu alaikum. I am Dr. Alishba Rasool, PGR Community Medicine, and today I will be presenting planning cycle under the kind supervision of Professor Dr. Saira Afzal. Learning outlines, introduction of planning cycle, steps of planning cycle, description of each step, recent updates, and MCQs. Learning outcome. At the end of the presentation, participants would be able to describe the planning cycle and its steps in detail. The planning cycle is a systematic process which enables managers and providers to determine how resources are used in relation to achieving their goals and objectives. Governments and NGOs of the countries around the world are working together to maintain health system and health for all worldwide. It consists of a series of 11 steps. The first 6 steps are sequential and their position should not be changed. The last 5 steps can be changed according to the needs of the existing situation. Steps of the planning cycle. Step 1, planning. Step 2, review of the policy guidelines. Step 3, situation analysis. Step 4, review of the resource availability. Step 5, development of interventions. And step 6, setting plan objectives and targets. Step 7, determination of resource requirements. Step 8, adjusting the management and organization system. Step 9, preparing the budget. Step 10, developing the plan of operations. Step 11, planning for monitoring and evaluation. Step 1, planning. The planning stage deals with the prerequisites that have to be in place and issues that have to be resolved before the actual planning exercise may start. The objective of planning the planning is to ensure that the planning process can be carried out smoothly. District health management team. Before planning can start, the planners need to establish the identity and position of the planning body, that is the district health management team. The district health management team is an administrative body for all the health matters in the district. It is not an elected body, but it is constituted by the EDO Health and DHO. The district health management team has a core and extended team. The core component comprises members working within the district health office, while the extended component includes all members of the district health management team. Role of the district health management team: determine specific terms of reference of the plan, including objectives, purposes, target group, and time period of the plan. Identify resource available for timing, tasks, responsibilities of the planning exercises. Assign specific tasks and responsibilities to each member of the planning body. Evaluating the planning process and the prepared plan. Step 2, review of the policy guidelines. Review of the policy guidelines is the process of familiarization with the government directives and conditions that prevail and must be followed in the preparation of district plans. The purpose of such review is to ensure that the district plan is in line with national or provincial policy guidelines. Despite establishment of the devolved governments at the district planners need to review national and provincial guidelines, review provincial problems. Step 3, situation analysis. The process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. Purposes of the situation analysis: to identify the health problem and health services need arising as a result of these problems, determine causes and circumstances underlying problems in the health situation as well as within the delivery of health services, to assess the availability and adequacy of resource in the light of health services need, to identify the gap and weaknesses in the healthcare services in line with the health problems and service needs. Parts of the situation analysis consist of a descriptive and an analytic part. The descriptive part describes the situation as it is present. This helps in assessing the magnitude of the problems, which in turn help in prioritizing the problems. The analytical part deals with the factors that determine the existing situation and is used subsequently for developing appropriate interventions. Sources of information for situation analysis: vital stats, census, health information system, hospital records, health system review, also called health system analysis, special surveys in the field, qualitative methods for data collection. Components of the situation analysis: it is useful to consider a situation analysis under the following 4 components, and this later may help while preparing a situation analysis report: determine the existing problems, prioritize the problem, ascertain available resources for addressing existing problems, and identify weaknesses and strengths of the existing system. Important criteria for ranking health and nutrition problems are magnitude in terms of proportion of the general population or of specific subgroups of the population, such as women, preschool children, school children, the elderly, etc., are affected. Severity and danger to the individual and community. How serious is the condition? Does it threaten life, cause major suffering, and decrease the ability to lead a normal life? Reduce productivity. Vulnerability to intervention. If a problem is not vulnerable to intervention, it makes little sense to include it in the list of those targeted for action. Cost of intervention, expressed in terms of cost effectiveness, must continuously be kept in mind in the prioritization of problems and political expediency. Even if a problem fulfills all of the above criteria, if it is not recognized as such by the district or high authority, it is very difficult to include it in among the high priority list, even when such a good action goes both against wisdom and common. Step 4. Review of the resource availability. A preliminary process to assess the resource availability that would assist in determining the scope of the district plan and selection of the intervention strategies. The objective of reviewing the resource availability is to enable the planner to stay within the frame of realism and limit of available resources in the development of intervention packages. Resource availability. Manpower or human resources in terms of number, cadre, gender, and quality of human resource. Material or physical resources, including building, equipment, and transport, drugs, contraceptives, and dealing with the availability and functioning of these. Money or financial resources to see how the financial resources are allocated in terms of their distribution with respect to salary and non-salary, their release and utilization, and whether the facility is government or non-government. Step 5, developing the intervention. It is the process of identifying, shortlisting, developing intervention measures from among a variety of potential interventions to identify and develop the most appropriate interventions and intervention packages for the existing health needs. Planners shall now identify and work out intervention measures and packages that can best address both. Select the appropriate intervention strategies to address the problem priority, adjust the existing services, establish additional services, and overcome the constraints to effectively implement the appropriate interventions and strategies. Step 6. Setting the plan objectives and targets. Setting the plan objective is the process of defining what one wants to achieve, sometimes also referred to as the expected results, within a planned period of time in light of earlier identified health need priorities and prevailing resource constraints. The main purpose of setting objectives will be to highlight what planners wish to achieve, quantify these, enable a focused selection of input and activities that will bring about these. Plan objectives are set in order to provide the planning body with a list of serious results likely to be achieved through implementation of the plan in the course of the plan implementation. Determining plan objectives. Number 1 is the health status. Number 2 is the service activity, management and organization, support systems, community involvement, inter and multi-sectoral integration. Improve reproductive health services in District Rajanpur. Maternal mortality shall be reduced from the current 340 over 100,000 to 300 over 100,000 within the 4 years. Short-term objectives. All pregnant women in all villages of district are given advice and are referred to antenatal services within the first year. By the end of 2003, 80% of women delivering in villages of district are assisted by a trained traditional birth attendant. Number 2 is the setting targets. To reduce maternal mortality, it had been decided that midwives have to be trained and regularly monitored, that tetanus immunization, prenatal care, emergency obstetric referral systems shall be provided. District Health Management Team now has to determine all of the following targets: number of midwives to be trained, number of training sessions to be held, number of tetanus injections to be given, number and frequency of prenatal visits, percentage of the obstetric complications to be seen. Only if activities are carried out in the right numbers can the outcome necessary to reach the objective, that is, reduce maternal mortality, be reached. Outcomes would be coverage of 80% of pregnant women with at least 2 injections of tetanus toxoid, 80% of women delivered by trained birth attendants, 70% of the women attending the antenatal care clinics, 66% of the complicated pregnancies referred to and managed at the THQ hospital. The impact, on the other hand, would indicate the percentage reduction of the maternal mortality rate. Matching the targets to performance standards. Planned service targets should be matched against expected potential performance standard using the available mix of resources. If the plan targets are higher than the potential number of services that can be delivered given available for potential resources and under prevailing constraints, objectives need to be modified to allow congruence between planned service targets and potential performance level. Step 7, determination of resource requirements. Identification of resource requirements is the systematic process of translating planned activities into resource needs. The purpose of this section is to identify to what extent existing resources cover planned intervention packages and to what extent additional resources shall become necessary. Step 8, adjusting the management and organization system. Management organization system is the coordinating center for all health service activities. Executive district officer health needs it with the assistance of a team of a district manager. The main purpose of the management and organization system is to ensure maximal efficiency and the effectiveness of the healthcare delivery system. Adjusting the M&O functions and activities. Among several functions of the M&O system, the more important ones address manpower, money, material issues, and the functioning of the support systems in general. Support systems, monitoring and supervision. Collection and analysis, reporting of the HMIS data and for the information from the health system analysis. Ensuring a functional referral system, repair and maintenance, drugs and contraceptive supply. Coordination of activities, coordinating different organizational sectors. Community mobilization. In what areas and with what activities should the community get involved with the improvement or delivery of healthcare? What actions are expected from the community? How may community involvement be monitored? At what frequency and when are meetings with the community representatives to be held? Step 9, preparing the budget. Preparing the plan budget is the process of translating inputs, targets, and activities into money. The main purpose of budgeting is to identify the overall financial requirements by plan period and individual year. Identify the financial requirements by the item, a line item, and by specific program and enable performance budget. Step 10, developing the plan of operations. A plan of operations is the written summary of the implementation plan specifying sequence and timing and responsibilities for the implementation of main objectives, results, and activities. The plan of operations serves to enable the plan implementing team to carry out all the activities associated with the execution of the district plan according to the predetermined criteria of time, quality, and quantity. The operation plan provides a set of ready guidelines for the day-to-day running and periodic assessment of the functioning of health services for the plan implemented. Plan of operations are derived from the targets and activities such as reflected in the table and further elaborated on the following operational aspects of the plan. Information in targets and activities matrix, what is to be done, how that has to be done, by who, whom, when, through what means, according to what quality control, and information in that Gantt chart, by whom, when, how often, over what. This is the Gantt chart that is shown. That by examining this chart, you can tell that what program is supposed to do at any given point in time, what it was to have done, and what still needs to be accomplished, who is responsible for what has to be done. If there were delays, the chart allows you to identify a time period to make up for the delay. Step 11, planning for the monitoring and evaluation. Monitoring and evaluation is a quality control mechanism and forms part of the management organization responsibilities. Because of its importance for the success of health intervention, it is being elaborated here in greater detail. The purpose of monitoring and evaluation is to render healthcare as efficient and effective as is possible within the given ecological and resource constraints. Monitoring and evaluation serve to assess whether the first four components of the healthcare delivery system, inputs, input distribution, outputs, outcome, as well as the support and management of the organization systems are in place, are functional, and match earlier established quality criteria. As such, it helps to determine whether objectives and results are being reached. Verify whether plans are being implemented in the way and manner they were planned to be implemented. Ensure that all components of the health service delivery system are in place and functional, and identify problems early enough to allow corrections. The SWOT analysis is a framework for identifying and analyzing analyzing an organization's strengths, weaknesses, opportunities, and threats. These words make up the SWOT acronym. The primary goal of SWOT analysis is to increase awareness of the factors that go into making a business decision or establishing a business strategy. It should be specific and avoid gray areas. To do this, SWOT analyzes the internal external environment and the factors that can impact the viability of the decision. Now it's time for the latest updates. Issues of healthcare planning and geoinformation system are reviewed. For the past 2,400 years, the spatial relationship between health and location has been a concern for researchers. Studies have been conducted for decades to understand such a relationship, which has led to identification of a number of healthcare planning issues. Geographic information system technology has contributed to addressing such issues by applying analytical approaches at the level of epidemiological surveillance and evaluating the spatial inequality of access of healthcare. Consequently, the importance of reviewing healthcare planning issues and recognition of the role of GIS are integral to relevant studies. Such research will contribute to increasing the understanding. Researchers have focused on developing and applying analytical approaches using GIS to support two important aspects of healthcare planning. First, epidemic surveillance and modeling, despite a lack of health information and its management. And second, evaluating the spatial inequality of access to healthcare in order to determine the optimum distribution of health sources. GIS is an effective tool to support a spatial decision-making in public health through applying the evolving analytical approaches to dealing with healthcare planning issues. This requires a literature review before preparing relevant studies. A collaborative healthcare framework for shared healthcare plan with ambient intelligence. The fast propagation of Internet of Things devices has driven to development of collaborative healthcare frameworks to support the next generation healthcare industry for quality medical healthcare. This paper presents a generalized collaborative framework named Collaborative Shared Healthcare Plan for Cognitive Health and Fitness Assessment of People using ambient intelligent application and machine learning techniques. It provides support for daily physical activity recognition, monitoring, assessment, and generate a shared healthcare plan based on collaboration among different stakeholders, doctors, patients, guardians, as well as close community circle. The proposed framework shows promising outcomes compared to the existing studies. Furthermore, the proposed framework enhances team communication, coordination, long-term management of healthcare information to provide a more efficient, reliable, shared healthcare plans to people. Now it's time for our MCQ session. Governments and NGOs of the countries around the world are working together to maintain health system and health for all worldwide. The process of thinking regarding the activities required to achieve a desired goal is which of the following? A, funding, B, planning, C, criticizing, D, evaluating, or is it E, policy guidelines? Does anyone like to answer this? Do anyone like to answer? It's B, planning. The planning cycle is a systematic process which enables managers and providers to determine how resources are used in relation to achieving their goals and objectives. Which of the following has the plan to ensure that the planning process can be carried out smoothly? Plan the planning, educating the people, situation analysis, political involvement, resource availability.
C.
It's A. The situation analysis is the process of analyzing and interpreting all information available from various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. What type of health is it? Which of its type help in assessing the magnitude of the problems, which in turn helps in prioritizing the problems? It's D.
A.
A Gantt chart is a type of bar chart that illustrates a project schedule. It helps teams to plan work and properly allocate resources to maintain bird's eye view of the project. It contains project tasks on a vertical axis and a horizontal axis. It represents A, perform task, B, time duration, C, name of organization, D, pending task, or E, task name.
B.
Yes, it's B. One of the four components which help in making the situation analysis report is problem prioritization. Important criteria used to prioritize health and nutrition problems include all except magnitude, severity, political will, personal preference, and vulnerability to intervention. It's D, personal preference. The objective of reviewing resource availability is to enable the planner to stay within the frame of realism and limits of available resources in the development of intervention package. The resource availability include all except A, manpower, B, material, C, methodology, D, money, E, physical resource.
C.
Yes, it's C. During COVID-19 pandemic, health planning team is responsible to review regarding availability of vaccine, vaccinator, and supervise on a daily basis updates of data. The main purpose is to ensure maximal efficiency and effectiveness of healthcare delivery. The task comes under the responsibility of which? Development Intervention Board, Review Policy Board, Management Organization Board, Finance and Budget Executive District Office.
E.
It's 7C. Monitoring and evaluation is a quality control mechanism and forms of management organization responsibility. The purpose of NM is to render healthcare as efficient and effective as is possible with given ecological resource constraint. All are given functions of monitoring and evaluation except A, whether objectives and accepted results are achieved. Identify that all components of healthcare system are in place and functional. C is the political involvement. D, identify problems earlier to allow corrections. E, help to define a project scope. It's D. SWOT analysis is a useful analytical tool to qualitatively and quantitatively examine and access a system such as the district health system with respect to all of its individual system components. Which of the following is true about preparing a SWOT analysis? A, it should focus on where the organization is today and not where it could be in the future. A SWOT analysis is objective. It should be specific and avoid gray areas. D, it should analyze the organization, only ignore the performance of competitors. It only analyzes the gray area. It's C, it should be specific and avoid gray areas. The main purpose of the monitoring and evaluation system, monitoring and organization system is to ensure the maximal efficiency and effectiveness of the healthcare delivery system. It is a function of management which refers to the process of integrating the activities of different units of organization to achieve the organization goals. This is called actuating. B, controlling. C, coordination. D, planning. Or E, developing intervention. What would be the right answer? It's C, coordination. This is the key of the MCQs. Thank you, everyone. Please like and share to our YouTube channel. Does anyone want to give any feedback?
Thank you, Dr. Alishba. It was a very nice presentation. You can end the meeting.
Okay, thank you. Allah Hafiz.
Allah Hafiz.